According to the Heart American Associations, around 103 million American adults have high blood pressure, also known as hypertension. If you have high blood pressure, you can lower your blood pressure by eating a healthy diet, like we have shown in our previous video about the top 10 foods to fight high blood pressure. In this video, we will show you 9 foods and drinks to limit or avoid if you have hypertension. You can probably guess the first one, which is salt. Salt and sodium in particular are your worst enemies when it comes to living with high blood pressure and heart disease. The 2015-2020 dietary guidelines for Americans suggest that people with high blood pressure limit their daily sodium intake to just 1,500 milligrams, whilst the average American eats about 3,400 milligrams a day, more than twice that amount. Around 75% of the sodium Americans eat in a day comes from processed foods and salt added to foods at restaurants and other food service establishments. It's not what they had at the table with a salt shaker. The second food is deli meat. Processed deli and lunch meats can be real sodium bombs. These meats are often cured, seasoned, and preserved with salt. A 2-ounce serving of some lunch meats could contain 500 milligrams of sodium or more. On top of that, if you had bread, cheese, condiments, and pickles, your simple sandwich can quickly become a sodium trap. The third food is frozen pizza. All pizzas can be a poor choice for people watching their sodium intake. The combination of cheese, cured meats, tomato sauce, and crust adds up to a lot of sodium. Frozen pizza is especially dangerous for people with high blood pressure because manufacturers often add a lot of salt to maintain flavor in the pizza once it's been cooked. One serving of a frozen cheese or meat and cheese pizza can contain more than 700 milligrams of sodium, sometimes even more. The thicker the crust and the more toppings you have, the higher the sodium level. The fourth food is pickles. Preserving any food requires salt. It stops the food from decaying and keeps it edible longer. The longer vegetables sit in canning and preserving liquids, the more sodium they can pick up. A whole dill pickle spear can contain as much as 390 milligrams of sodium. The fifth food is canned soups. They're simple and easy to prepare, especially when you're crunched for time or not feeling well. However, canned soups are high in sodium, reaching almost 900 milligrams in just one serving, which is typically a half of a cup. Canned and packed broths and stocks can be bad for blood pressure too. If you eat the entire can, you'll be taking in more than 2,000 milligrams of sodium. A better option is to keep the salt in check by making your own soup from a low sodium recipe. The sixth food is canned or bottled tomato products. As a rule, tomato products with added salt are problematic for people with high blood pressure. Most canned tomato sauces like ketchup, pasta sauces, and tomato juices are high in sodium. A half-cup serving of classic marinara sauce can have 400 milligrams of sodium or more. A cup of tomato juice can come in at more than 600 milligrams of sodium. If you're looking to lower your blood pressure, choose fresh tomatoes, which are rich in lycopene, an antioxidant nutrient, also linked to health benefits ranging from heart health to protection against sunburns and certain types of cancers. The seventh food is sugar. You likely already know that excessive sugar intake has been linked to increased cases of weight gain and obesity. But did you know that high sugar intake is also linked to high blood pressure? Sugar, especially sugar-sweetened drinks, has contributed to an increase in obesity in people of all ages. High blood pressure is more common in people who are overweight or obese. The American Heart Association recommends that women limit their added sugar intake to 6 teaspoons or 24 grams per day. Men should restrict themselves to 9 teaspoons or 36 grams per day. Before we reveal the last food, please don't forget to subscribe to our channel if you're curious about science applied to health issues, and hit that bell icon so you receive the notifications every time we upload a new video. The last one is a drink, alcohol. Small to moderate amounts of alcohol may lower your blood pressure, but also drinking too much alcohol can increase it. Drinking too much may also increase your risk for many cancers, even if you have these excesses occasionally. A study shows that having more than 3 drinks in one sitting can cause a temporary spike in blood pressure. Repeated drinking can lead to long-term blood pressure problems. Alcohol can also prevent any blood pressure medications you may be taking from working effectively. In addition, alcohol is full of calories, must be metabolized by the liver, and can lead to weight gain. If you're overweight or obese, you're more likely to have high blood pressure.
Please note this video is our interpretation of scientific papers. It is merely informative and doesn't constitute any form of advice. If you have any health issues or concerns, please contact your physician or licensed health professional.